Good morning, everybody. Ms. Janet Wong, Ms. Therese Chow, Professor Arthur Lee, friends, colleagues, ladies and gentlemen. On behalf of the Chinese University of Hong Kong, I'd like to extend a very warm welcome to all of you for coming to this Saturday morning to our CUHK Summit in Healthcare Innovation and Biomedical Engineering. This is a meeting co-organized by the CUHK Technology Center for Innovative Medicine and the Department of Surgery. Like many places in the world, healthcare is a very important industry, and you have heard from the first day from Lord Aradasi's lecture that in the last 100 years, the longevity of mankind has expanded twice. And that is largely because of improvement in public health, but as well in innovation and technology that revolutionized many aspects in healthcare. That's why we at the Chinese University would like to really bring the strength of our clinical departments together with our engineers to work on biomedical engineering in order to break new grounds in developing new technology that can benefit our patients. A few months ago, when Philip was discussing with me about the future development, we thought it would be a good idea to have a conference that brings engineers and medical doctors together to discuss what we need in the hospital in managing patients' care and what we have in the laboratory that our engineers can provide. That's why this meeting, Medicine for the Future. And here I must thank Ms. Therese Chow for her generous donation for the establishment of the CUHK Technology Center for Innovative Medicine, which gives us the seeding fund to establish a group, a platform that allows our engineers and our clinicians, especially surgeons and radiologists, I presume, to work together on various areas. And I would also like to welcome the Imperial College and colleagues from other parts of the world to become our partners in such endeavor. We know very well that the Hamlin Center in the Imperial College is a world-leading center in this aspect, and we would very much like to learn from you and to share with you our research and our experience. And we hope that by putting 1 + 1, we'll have 3 or 4 coming out. And last but not the least, I must thank the government for their support, especially the Innovation and Technology Commission. I understand that the Hong Kong SAR government has put in great resources into future development in innovation. And innovation in life science is one of our future direction. So I'd like to thank you, Janet, for gracing us in a Saturday morning. You told me that you are not an early person, but you really try very hard to support us. And Arthur, congratulations on your very important position, which is on the newspaper, every newspaper this morning. And we look forward to your future support as well. Thank you.
Professor Song, Ms. Therese Chow, Professor Arthur Lee, Professor Falk, Professor Chen, Professor Philip Chiu, distinguished guests, ladies and gentlemen. Joseph said that I am an early person. That is true. I am about to convince Joseph to conduct an R&D research that there are 2 types of person, the lark type and the owl type. Because I'm certainly the owl type. I can work through the night without a wink of an eye. Today, I'm very honored to be here to attend this very prestigious seminar, and also a seminar which meets the urgent needs of our community. In Hong Kong, healthcare services account for the 2nd largest expenditure in the government budget. And in about 25 years' time, our citizens aging 65 and above will surge from the currently just slightly above 1 million to 2.6 million. That means by 2041, 1 in 3 of our population will be at that age. range, and there will be a great challenge to the medical and the healthcare sectors. As I represent the Innovation and Technology Commission, I would need to speak on my work to advertise a bit to see how we can collaborate with the other sectors, like the medical sectors, to help to address this growing problem. First of all, my department is called the ITC, and it is not a very big department. It's just about 230 people. But we have a lot of quasi-government organizations under us. For instance, the Hong Kong Science Park, the Hong Kong Productivity Council, the S3, and Logistics Center, and all that. So we execute a lot of our initiatives through our Quango, so-called, and to allow them to explore R&D, we have got a sort of a venture capital fund called the ITF Innovation Technology Fund, which is 30 million per project for a period of 2 years, but projects can go on from 2 to 4, it's just in phases. And it requires 10% contribution to start a project. If it is a platform project whereby government will pay 90% and the company, the sponsor, will pay 10%. But recently, we are very much in great support of taking the research results from the laboratory to the real world. And so with the support of a government department, like the Department of Health or the Food and Health Bureau of Dr. Ko, and university can actually start a project without any industry contribution. This is because we realize that in some cases it is a bit difficult to get the industry contribution, and sometimes just to get that small amount of money, the company will have great access to all the confidential information of a department, and the department may not prefer that. So, well, we feel it is cleaner. A government department plus a university. No need to have any industry contribution, and the project can go ahead. And also, again, to take the R&D from the lab all the way to the real world, we have also extended the scope of ITF. Years ago, the ITF only ended with a paper report. We have extended it again and again, first to the production of samples, prototypes, that was about 2 years ago. And now we have even liberated it further. Now it can be used to cover development engineering, system integration, compliance testing, clinical trials, and if there are already good research done outside Hong Kong, we even fund the university to license the third-party IPs and use it in the Hong Kong project to customize, to localize, to suit our needs, and industrial designs and all that will be covered. So basically, nowadays, an R&D project can start all the way from R&D to the very near to the end of commercialization. Probably the only thing that we are not funding is marketing, product marketing. But in the devising of a new scheme called the Entrepreneur Support Program, which is a matching scheme for a company, 50, government 50, we are also considering that to be very liberal because, in the whole world, everybody is raising after INT, and if we don't be very open-minded, we will lose out. Apart from the funding support, we also promote R&D from campus to the world through special measures tailored for the university. We have got a grant for the TTO, the Tech Transfer Office, providing up to 4 million a year for each university to enhance the capabilities of tech transfer, like IP, recruiting marketing staff, IP specialists. We also have a scheme called what we call TISU, actually is the Technology Startup Support Scheme. basically each universities will be given 4 million to enable the university to select itself the best teams or products that can be invested to be formed companies and be given a try to see how it does in the real world. And I am very happy to hear from my colleagues that the Chinese university is one of the universities with the best and most speedy response. So I really look forward to see what will grow out of this. And last is we have what I just mentioned, the Entrepreneur Support Program, which will replace the former Small Enterprise Support Program. In that, the limit will now be 10 million, matching 10 million government and 10 million from the applicant. And for the applicant's portion of 10 million, we have liberated. It can be his father-in-law, venture capital, angel investors. We follow Mr. Tang's black cat, white cat, good cats. We say whatever money is good money because you pay first and we pay later. So we really don't have much risk. And this has also become a grant, not a loan, as in the case of the previous CUHK program. And in another area, we look forward to collaboration with Chinese university on the healthcare side. That is how to, in advance, plan for the elderly population. Yesterday, I just had lunch with Mr. Zhang Leung, the chair of the Charitable Trust of Jockey Club. And they are extremely passionate to push elderly. We discussed that today the reception may not be that great. Some old people may still don't know these gadgets, but I comfort the audience that when I turn old, very quickly, maybe after 15 years, I will be real elderly. I think I will be very receptive to all the things Cadenza is doing. And so we really look forward to have a good collaboration on this front. And I have also spoken to my colleagues in government that, the Labor and Welfare Bureau, that this will be very important. And so today, with so many outstanding medical practitioners here and with such a good program, I really look forward to you contributing to good ideas, and if you have good proposals, do consider to come to the ITF. Thank you.
May I invite the following guests to come on stage and take a group picture? Professor Joseph Sung, Vice Chancellor and President of CUHK. Ms. Janet Wong, Commissioner, Innovation and Technology Commission. Ms. Therese Chow, Solicitor, Notary Public and China Appointed Attesting Officer. Professor Alpha Lee, Emeritus Professor of Surgery, CUHK. Professor the Lord Darcy, Paul Hamlin Chair of Surgery at Imperial College London. Professor Guangzhong Yang, Director and Co-founder, Hamlin Center for Robotic Surgery at Imperial College London. Professor Tai Fai Fok, Pro-Vice Chancellor and Vice President at CUHK. Dr. Lee Swarmstrom, Director at Legacy Minimally Invasive Surgery Program at the Oregon Clinic. Professor Philip Chiu, Director of the CUHK Technology Center for Innovative Medicine. And Professor Yang Yam, Professor at Department of Mechanical and Automation Engineering of CUHK. On a count of 3, our photographer will take the picture.